transmit, especially if the numbers are overwhelming. So far, there's minimal role to play in ED with regards to COVID patients. What is your experience at Peninsula Health?
Oh yeah, so we've, I mean, despite the second outbreak or wave, I mean, we haven't needed to sort of use it on a large number of patients in the setting of triaging patients, but certainly the literature mentioned that how useful it can be, because once you combine the data, clinical data about how they appear, the respiratory, all the vitals, respiratory status and saturation, and the ultrasound findings, then that could potentially help in deciding to send the patient home or to admit. Obviously, you don't depend on the lung ultrasound on it in itself, but and this is mainly from suggested data from overseas, and especially in Italy when the wave was too large and the systems got overwhelmed. Any other questions?
Are there any other questions? If there isn't, then thank you very much, Dasim.
Thank you.
I will pass on the baton to Abrar to present his talk. Hi, Abrar, the ball's in your court.
Hi, everyone. I'm just going to start putting on my presentation on. Mahesh, if you can tell me that the presentation is running, that'll be good. Thanks.
Yeah, it is. I can see it.
Right, so welcome to our regional teaching session, and I'm Abrar, and I'm a face with Peninsula Health. Some of my portfolios include being one of the leads on ultrasound, fellowship OSCE prep coordinator. But more importantly, one of my roles is to be the mentoring coordinator for the site. And also I'm part of the Wellbeing Advisory Group at Peninsula Health. We have a Wellbeing Special Interest Group that's primarily formed by myself and a few of our nurses with the special interest in this area. So that's really where I'm coming from. So today I thought I was asked to present on well-being as a topic, and well-being is one of our trainees recently joked to say that well-being is like the ultrasound of this decade. Well-being is hot right now, and especially with COVID bringing a spotlight into this issue ever more, that it's becoming important. But I started my well-being journey as a medical student in third year at the University of Newcastle, and did a rotation in Melbourne in my third year, where I actually traveled around to regional and rural GPs around Melbourne, which involved interviews and surveys on GP well-being. And interestingly, the issues haven't changed in 12 years since I was a medical student. And my interest further peaked as a junior registrar in 2012. And I've always maintained a bit of an interest in well-being. About 2 months ago, when I was first asked to present on well-being, we were in quite a different area in Melbourne. We were at the start of July, and we were starting to see cases peak up again. And this was sort of heading into an explosion of the wave 2, and looking at harsher conditions and lockdowns, which have eventually happened. ASAP put this tweet out recently about Deepak Chopra presenting at the ASAP 2020 conference later on this year. I'm not the Australian Deepak Chopra, and I think this sort of tweet was quite heavily criticized as well, because I think people realize that well-being is not just about band-aid solutions, about talking about resilience and talking about mindfulness, yoga, or advice on diet and exercise. So you will not hear any advice on any of those, but I want to talk about some concepts of well-being which affect particularly our doctors in this environment that we work in at the moment. So we'll talk about the well-being from an individual concept as well as the team's concept. We have a well-being snapshot survey that we've performed that I'll discuss in the results of, and also how does COVID affect us, and what can you do, and what have we done so far. So how do you judge well-being? Well, one of the ways to actually to understand that is that we don't actually work in isolation as a healthcare worker. We don't rock up to work just as a work self and leave our personal life behind. We carry the effects of one or the other into each area, and perhaps for the first time, the crisis we face is spread across both work and home. It's constant, as Mohan explained earlier, and usually we're the ones who are doing the work in hospitals have been now at risk for the first time, where we are acutely aware of the need for safety. So it would be nice to have a well-being barometer that we can just address each and every time, but that's not really possible. So we decided to do a snapshot survey, something that you can repeat every term, and you can follow as a progress down the track. And but when you do perform a survey, you have to be ready to accept the results. You have to be ready to take the feedback on board. The survey that we performed was sent to HMOs and registrars, was sent in early to mid-July. It was a cohort of about 50 HMOs and registrars. And I always say that HMOs are important to include in these sort of aspects of well-being, because they are our registrars of the future, they are our consultants of the future. So the first question I asked was, what are the most important well-being issues for you? We started by asking basic questions. We asked 6 questions in total. Now these questions are actually tried and tested, validated questions from other surveys done in Queensland from the RAP-EM group. I don't know if you are aware of that, but they're a group that are doing a fair bit in this space. So the question number 1 that I asked was, okay, what are the most important well-being issues for you? And the response rate we had for all the questions was about 32 out of possible 50. So that was actually quite a good response rate for a survey. Usually you get a much lower response rate. Unsurprisingly, emotional well-being was top of the list, followed by physical activity and exercise. A third was social well-being, which again is very important. Social well-being as a dimension of health refers to our ability to make and maintain meaningful relationships, regular contact with people in our sort of sphere, which is family, friends, neighbors, and co-workers. As you can imagine, that's all been quite restricted in COVID times. We'll talk a bit later about how that's impacted our cohort, but in sessions gone past, we'd be in a big lecture hall, for regional teaching, listening to this presentation, and we'd have a chance to catch up, with coffee and lunch. But here we are on WebEx. There's interestingly, nutrition and food is bottom of the list with only 28%, feeling it was important to them. And the reason, and it's been interesting that it's been noticeable that food choices appear to have headed more towards comfort food in general. I don't know if that's your experience. You can type in the comments box if you feel that way. Pizzas, donuts, muffins. And it's also likely that there's also extensive media messaging of what constitutes a healthy diet and possible easy access or ways of achieving this. So most people know that having a large cheesecake slice is not as healthy as having a piece of fruit. That's, it wasn't a surprise there, but obviously emotional well-being and mental health were top of the list. Now, the next question you asked was, what factors contribute to your ability to function on a shift-by-shift basis in the ED? So we looked at factors such as sleep quality, fatigue, level of access to healthy food, stress, and the rostering schedule. And surprise, sleep quality, fatigue, and stress all came out on top. And, it's understandable. They're all linked. If you are fatigued, you don't sleep well, and vice versa, it's going to cause you a lot more stress as well. Now, in keeping with the previous question that we had, the level of access to healthy food was not considered as important. really now we know what our choices are. As Dale mentioned, he's happy for the Colonel KFC to provide what's needed. The access is not really considered as important. So now a rostering schedule, as you can see, 14 HMOs and registrars brought that up as an issue, and there are various factors and different levels to account for this feeling, and I'll mention about rostering specific issues in the next couple of slides. Now, when given the chance to then sort of demonstrate which activities you'd be interested in, your health and well-being activities, about 50% of the responses mentioned access to team building exercises as a primary need. I think that's reasonable because our team building, which used to be partly be covered by our registrar teaching on Wednesdays, has all gone online now. That team building aspect of it, and going out for registrar lunches, and doing bowling, and going out to parties and stuff has completely sort of gone, and that was all part of team building. The next closest stat that we had was a 25%, which was information on counseling and mental health services. So essentially, questions like this really give us good information in the sense of what this cohort is actually looking for and what are the issues that we can address quickly. We may not be able to do justice to everything, but at least we know how people are, going and what they're feeling. If we look at our question number 4, I really wanted to know how frequently do people want these activities to occur? So I said, okay, fortnightly and monthly were sort of were the preferred choices. And I think we do have, in terms of our Wednesday teaching weekly, it would be not too difficult to slip in an activity in there once a month. But there are obviously quite a few different stakeholders in this space, and not everyone can have the time allowance, on a monthly basis. But at least we can try. We can also do it outside of hours and on weekends. As an example, we recently conducted a Wellbeing drop-in session with our fellowship OSCE candidates on a Friday night, which was hosted by Mohan, to support them in terms of their uncertainty for exam cancellations and their progress. So those are sort of the ideas that I was looking for. I just want to talk about some of the aspects of what really helps and how we're feeling in the COVID era. And we'll go on to that with the next slide. Some of the feedback that I promised to talk about was on rosters. And I think rostering is an issue in most sites that I've actually worked at in the past. And some of the feedback that we received in this survey was about consecutive shifts. Mostly consecutive evening shifts were something that people didn't like very much. Working in the COVID area shifts as well was an issue. And as you can imagine, COVID area shifts, if you are being rostered there continuously, that's not going to help you very much in terms of your anxiety, and it's difficult to work in full PPE, as we all know. Evenings versus days, the ratio of evenings versus days was another important feedback. And as I was talking to our director recently, we have to take these comments and feedback on board and try and do our best with this. Interestingly, quite a few people mentioned scheduled break times, and I know that our nurses do a really good job with scheduled breaks, and almost as soon as the shift begins, they're planning their breaks. And I think we should also, as doctors on the teams, I think take a leaf from their book and actually take a page and actually start introducing that as well. And that's something that I consciously try to do. But I think scheduled break times is, is a good concept for us to actually work towards. A few comments mentioned on-site gym and exercise as a way of to actually alleviating your stress after a shift, even if it's only for 20 minutes. And less meetings. So less meetings and less sit reps and information sessions, especially to do with COVID, was quite a frequent comment. So in terms of how life used to be, life was when I was a registrar mostly carefree. carrying on with, with our training and then eventually coming out to the other end. But unfortunately, COVID has really thrown a bit of a spanner in the works. It's not really quite like that anymore. I think there's a lot more awareness of the risks and dangers like out there. And what really does happen in these sort of times? Well, we know about the concept of surge capacity, which is the ability to manage sudden increase in demand for our services. We're all quite well aware of periods of surges in emergency departments. Now, a similar concept has been put forward to us in times of stress, which is a personal surge capacity. It was a term that I've come across coined by Professor Anne Maston, who is a child psychology professor who studies a lot in this area. She's from the University of Minnesota in the U.S. And the concept basically is applied to the person and the human being, where you have a collection of adaptive systems, both mental and physical capacity that we draw on. And we all know in the early months of COVID, we were all working very differently. I think I know personally, the way I managed myself was to actually try and read and learn everything on the literature that I could find on COVID, read all the news, keeping others up to date, talking to family, ramping up all my systems, and both personal and at work. And after some time, you start to feel like you are actually depleted. And I think that is a concept of surge capacity. You meet your capacity and that's it, you're done. I think, especially with the emergency phase in Victoria now becoming chronic, we never really entered the recovery phase, as was postulated by many publications. There was a publication by the Royal Melbourne in May this year, I think it was, where they actually talked about all the different phases of a pandemic that they were planning for. And the last phase was the recovery phase. Well, we actually haven't made that phase yet. So this has become chronic. And in terms of our society and systems, like everything is struggling. So people are losing jobs, people are losing the sense of connection. Homeschooling is putting a bit of strain on parents as well, and there's no rituals. Now, there's an interesting graph that looks at surge capacity and can be applied to personal surge capacity as well. And there's an article in 2006 in the US that looked at a pandemic 1918 flu event sort of analysis. And you can think about surge capacity in a similar manner. You have a defined pre-incident capacity that you operate at. You have an event that happens and it slowly sort of overwhelms your capacity. You basically have an initial surge where you rely on all of your adaptive systems, you ramp everything up, and then it starts to deplete, and then you're back down to where it was, and it's actually you're not operating optimally in that range. So what are some of the ways that we deplete our surge capacity? Well, a big source of frustration for many of us are the attitudes of the general public. I think even people in your own circle and family and friends, the repeated shutdowns in Victoria, the mass panic buying, the refusal to adhere to government advice is often a source of dismay to a lot of healthcare workers. And I think it's we may feel a bit let down by society. I think we know the risks we take and the understanding we have a medicine that we know this is not, it's not just another flu, which I think it was a source of frustration for many. Now, it can lead you to feel a moral obligation to help others, understand what you already know. And I think a surefire way to endanger your well-being is to actually jump on the internet and try and comment on some of these threads, and especially news articles. I know I'm guilty of this for sure. I think practically most of May, June, spent browsing all these articles and reading all of these comments from people that were essentially denying that this thing actually ever existed and then commenting on it. I think in the end, you end up doing harm to yourself, and in your attempt at education of others, you're actually depleting your own personal search capacity. And I think we all get, it's a very common feature of all sites. We get multiple emails every day. We have multiple meetings and sit reps, hospital-wide conferences happening everywhere whenever there's an outbreak. We have daily DHS updates and emails from all the different sites that we actually work at. We have policy guidelines, we have national guidelines and international literature, and of course, all of our beloved WhatsApp groups where we all discuss. You sometimes wonder, whether it's, you're actually experiencing, not just a expansion of knowledge, but whether or not your brain's actually exploding from confusion. I think these days we're now doing a lot of online learning, and we essentially, I think it has its limitations. As you can see now, only one person can speak at a time. And our visibility of colleagues on the screen can be quite difficult as well. It's important to understand that we can't actually detect nuance, and we can't detect any emotions. You can read some facial cues and recognitions, but generally speaking, if people have their camera on, you can't. And interruptions can be quite frequent as well. I think more often than not, you don't get any real-time feedback as to how your talk's going, and if there's any specific features that people are not responding to very well. I think the same applies for other forms of online communication. I think where we used to have disagreements and sort of complex issues, you really can't trash it out really well in your Microsoft Teams or in your Zoom chats. I think during breaks between the sessions and stuff, you can't really get together. It just lacks that impersonal sort of feedback. I think it's important to remind ourselves that in this sort of context that we have to have a level of understanding that we didn't used to have before. I think, personally, I think, and I don't know about everybody else, but I really miss having what this slide shows. I think that enjoyment from actually sitting down with patients, actually going to review them, the smile on entering the room, shaking hands with them. And I miss having the relatives in the room as well. And to actually have that connection to your patients, I think we're all aware of what the close contact definition is. I think, Emma mentioned, 15 minutes classifies as a close contact with a positive case. So that really affects the way you interact with patients, the way you go into the room, the way you touch and like anything in the room, all of our actions, standing 1.5 meters away, unless you're actually examining them. That definitely has an impact on patient care and yourself as a person. And I think that's the part sort of, I think, like I miss the most. Now, in the early phase of the pandemic, we started off by saying, okay, well, how do we get around this? We can't shake hands, we can't do those sort of things. Well, can we do an elbow bump? Feel free to comment in the box if you guys are still doing elbow bumps, but I doubt it. I think with the workplace healthcare infections and distancing a priority, I don't think that happens very much anymore. Personally, I think in terms of your alternatives, feel free to write in the your preference. Really, I usually sit with a head nod and a wave these days. I find the namaste greeting works really well. Foot bumps, don't do them. Hip bumps, definitely not. And I don't put my hands in my pockets. I think definitely can bow. But I really, just essentially the wave and the nod, I think, is my sort of way of communication. We can't really salute anymore properly. As soon as you lift your hand up to a salute, like I tried that with Mohan recently, and I think I realized my hand just hit my visor. I had to decontaminate again. Now, I think another issue is masks. Now, masks, they mask one of our most important social cues, which is smiling. I think now smile really shows interest. It conveys warmth. It lets our patients know that they can trust you. in this pandemic, this component is partly lost, and I'll tell you why I say partly lost. We started with surgical masks, and now we have N95s. Masks, they muffle your speech. The deaf can't lip read anymore. And you know, I remember telling people in an apartment about the two different types of smiles, and it's something that I've struggled with more and more since then. But the two types of smiles will be the lips-only display, where you just lift the corners of your mouth and make a smile, really. The other smile is a Duchenne smile, which is also known as smizing. I've found out recently. I didn't know smizing was a term. Now you might ask, what is a Duchenne smile? Well, a Duchenne smile is coined after Guillaume Duchenne, the French neurologist who we're all familiar with, who's lent his name to Duchenne muscular dystrophy. He did a lot of work with patients about facial expressions, and a Duchenne smile is a smile that lights up your whole face. You have your zygomaticus major and your orbicularis oculi, lifting the corners of your mouth and squinting the eyes. This is the kind of smile that we can all achieve in a surgical mask, even when your mouth is hidden. I think it's harder in the N95 mask. With some people, it actually constricts their face and restricts the way they can actually make expressions. But I'll give you an example of a Duchenne smile. So you can see here, this gentleman is actually demonstrating a Duchenne smile with a mask. The researchers initially postulated that a Duchenne smile was indicative of a true smile, and happiness. That other version was just fake. But we now know that a Duchenne smile is most likely an artifact of an intense emotion or an intense smile, an extreme happiness. There'll be no prizes for guessing that this man is clearly smiling, even with the mask on. So what are the other ways to convey emotion with your patients in this pandemic? Well, you can still make eye contact, difficult with a visor on, and N95s, but you can still make direct eye contact. You can alter the tone of your voice. You can make gestures, and I quite like using gestures, especially with children. Children, when we see in our pediatric area, they really struggle with healthcare workers in masks at times, and that can be quite scary and confronting. My own son had to present once and have his finger sutured very early on in the pandemic, and seeing all the masks and everything, it was quite disconcerting for him. Body language is very important. Having an open posture, standing with some confidence and in a non-threatening manner. And I quite like using stories. I think stories are still a good way to relate to people. We had a trauma patient recently who actually intentionally fell off his bike because he was about to hit or collide with a truck going through a roundabout. And he's an experienced motorcycle rider and quite an older gentleman, but realized that if he went straight into the truck on his bike, he would be pretty much finished. So at 70 kilometers per hour, he slid off his bike and deliberately crashed so he could actually slide it off. Now, the story that I used with him was that, I sort of figured maybe this chap actually is a fan of MotoGP. So I related to him a story of the MotoGP rider recently in one of the Grand Prix who actually did this same thing, but he did it at 300 kilometers per hour when his brakes failed on his bike. So that was my way of relating to him, and that's set the tone of the relationship for us to be able to look after this trauma patient. Let's go through a bit of a trial. I'm going to show you a few slides, and I'd like you guys to have a shot in the comment section of telling me what emotion is being expressed under a mask. So we'll go with this one. So what do you think? Which of these emotions are being expressed in this patient? I'll keep the chat line open and have a look. What do you think? Surprised? Yeah, surprised. Excellent. This is the expression of someone who is surprised. Now, let's go with the next one. Let's see who gets this one. What's this gentleman doing behind this mask? Is he angry? Is he happy? Is he afraid? Is he surprised or is he sad? Good. So most people are answering happy. I'm really happy about that. Let's happy but not very happy, Dilu says. Yeah, that's good. That's good. All right. What about this one? Is he angry? Is he happy? Is he afraid? Is he surprised or is he sad? This one's a little bit tricky. Some people might say surprised, and some people might say he is afraid. So it looks almost like a 50-50 sort of thing, isn't it? But most people are saying surprised. Well, he's actually afraid. So the key difference between surprise and being afraid, you can see the wrinkling of his forehead. You don't have that people who are surprised unless you're surprising, extremely surprised. Someone made a joke, the surprise the surge rage won't admit the patient. Yeah, true. Yeah, that's true. Now, what about this one? Is she angry? Is she happy? Is she afraid? Surprised or sad? Someone said angry. But majority of people are pretty spot on the ball. They're saying sad. Yeah. So she is sad. That's true. I have the answers, so I'm correct. That face when you're rushed onto COVID. Yeah, that is true. Yeah. So, okay. What about this one? Angry. Yeah, no points of guessing is angry. The eyes narrowing as slits, eyebrows furrowing down here. This chap is angry. He's pissed off. He's rostered onto COVID. Yeah, that's right. So, look, I think we have to, get creative with the way we do things in COVID, with both self-care and team care. And I'll just go through a few of these slides now with you to see how we did that at Peninsula Health and what are my thoughts on that. So I think it's important as a team to actually have a wellness charter, and this is our Peninsula Health ED Wellness Charter. We basically have said no one struggles or celebrates alone. We recognize that emergency department work is demanding both physically and mentally. We have staff to feel psychologically safe to bring up concerns, both personal and departmental. Staff to feel supported, valued, and nurtured, and to build a culture that deepens the bond between staff and organization to create a sense of belonging. I think you have to work at it. You have to institute some of these things, and it's very hard, but it is possible to do it. Part of the thing that I'd like to sort of espouse and I'd like to present to you guys is to have a shift well-being plan. Actually start fresh again, on every shift, get involved early, teach someone something new, have a physical and mental presence, to check in with others, critical but simple tasks. Don't let the mind drift towards the outcome. When something doesn't fit, always ask why, and that's just a personal one of mine that keeps me on track. Take a break is very important, to eat and drink. And at the end of shift, think what actually went well, and most of all, to enjoy yourselves. I'm quite happy to actually send my slides off to people that are interested later if they actually really want to keep this. And I keep this in front of my table all the time, and I really try to follow all of these with every shift that I do. We also came up with the end of shift staff decontamination, which was actually something that went quite well. I prepared this in March when things were really ramping up in the first wave, and a lot of people were asking, what should we do? I think it's important that we realize that, it's quite difficult for people to be able to decide what to do with their routines. As we say, well, this is the way you can do this. You can prepare before the shift about what you actually need. Once the shift is over, you sanitize all your items, wash your hands, change your clothes, and make sure you shower before you create your family. And this was something that relieved a lot of anxiety for a lot of our staff and gave them a bit of a focus on infection control and to actually do this on a regular basis. And I often find it's important to show some vulnerability as well. It helps normalize your conversation around COVID and burnout. I think it's important to sort of demonstrate that as a role modeling to a leader, to actually say that, I think, things are not going that well. Someone asks you, how are you going? Well, so you can say, well, gosh, last week, was quite rough on me. Really struggled with my COVID shifts, and I'm still struggling with homeschooling and juggling work. And I think you can also say, caring for some patients is challenging. And I think role modeling that as a team leader is important. It leads us into, listening. So listening in communication, you want to be an empathetic listener. You want to be a person who says, I want to hear you, rather than a dismissive listener who says, I want to fix you, rather than saying it could be worse. So the same thing happened to my friend, or the same thing happened to me. I totally get it. You can say, well, that sounds heavy. Tell me more. I'm listening. Is there anything else I can do for you? And I think it's hard, but I think it's a conscious effort to do that is important. I think it's important to be kind, and it's something that I think, it's not easy. It's not easy and natural to be kind all the time, especially when you actually are faced with other team members and inpatient units that will test your will. But it's still important to actually carry on. I think everybody in the hospital is struggling. They have their own personal battles. Every trainee has the same stress with exams. You have to give them the benefit of the doubt. You need to help them. I think do less of us versus them and practice a lot more compassion. Also practice self-compassion. Try to develop the ability to actually forgive yourself, because if you can't forgive yourself, it's actually going to be very difficult to move on with your psychological well-being, even if you make mistakes. That's something I would say that's important. I think try to filter all of the information that you consume. Limit your daily news coverage. Avoid your live telecasts and avoid your Facebook's social media comment sections, which are very tempting to comment, and try and correct the general public. Try and attempt to limit the number of workplace sit reps and debriefs that you can attend. You don't have to come to all of them. If something is really important and a piece of information, it will be eventually communicated to you. Try and focus on what's important. Testing criteria, for example, in the early days, PPE and flow. I think be deliberate about setting your boundaries. Set aside some COVID-free time and encourage and support staff leave. I don't know about you guys, but a lot of our consultants ended up getting dogs as well. I'm not saying to all the registrars, go and get a dog, but it seems to be a good coping strategy for a lot of people. I think there's definitely a feature of this pandemic, and dogs are pretty expensive. I think we also did an eye challenge with staff members, where we started this in Frankston, and I've heard it spread to the other EDs as well, where people post up amalgamations of their pictures and photos that they took. And actually, we were having some fun guessing each other. And surprisingly, the vast majority of people guessed correctly, which tells you how important your eyes are with your actual communication. We did a Wellbeing conference for our registrars last year, and this was actually done in person in October, but we're planning another conference like this sometime this year. I'm hoping we'll probably be able to do this in November with some restrictions easing at some stage. But we did a fair bit of modules on ultrasound games and performance optimization, which actually was received quite well as well. A concept like this is something that I think you guys might have seen. It's Ikigai. It was a Japanese concept about reason for being. And when you get registrars to actually put down what they actually love and what the world needs and what can be paid for and what you are good at, you'll be surprised. A lot of people have different responses, and a few of those registrars are in this group. They actually found that they were very quick to put down what you love and what the world needs, but they struggle to put down sometimes what you're good at and sometimes also what you can be paid for. So I think you'll be surprised if you did this activity yourself and try to come up with these areas that you might actually realize something about yourself they didn't know. And I would encourage all of you guys to do this if you can. Posting on Facebook on our ED page as well, just to getting to know your teams and things. It's important, and this is just like some of our ways, and it's just an example of what we did recently. If you guys are really into poker, we used to do this in person, but you can take this online. We did this recently on an app called House Party and pokernow.club, pokerclub.info, and you can actually take your activities that you used to do in person online. These are some of our registrars and also some intensivists as well. Not really consultant cash, actually, but yeah, we did have some big pots. It's not illegal to gamble with money as long as everything is distributed, I'm told. You can have online games that you can play, the same thing as well with. There's an online poker app called governorofpoker.com that you can do. I don't get any money for promoting these websites, by the way. These are the website apps. We did a consultant's wine and cheese well-being debrief, which was actually very, very well received recently. This was a well-being debrief that we did on Zoom, and for all of our consultants and also some of our ANUMs as well. And we can see how we actually had a reasonable turnout. This was just the beginning of it. We actually had about 20, 25 people and ended up rocking up. And these are all of our consultants, and we had a very good time. And there was nothing moderated, nothing planned, and this was like a big party online. So I think I would encourage this. If registrars can do this as well amongst yourselves, so some of your leads with the well-being can do that. And it's a very, very interesting activity, and you get to know people outside of your place of work. We can't do dinners outside anymore, so this is a good way of doing that. And I think this is one of our nurses who's arranged a similar ED Friday night fun, and we actually have a ED a trivia quiz challenge happening this Friday night as well, which is coming up. So all of these are activities that you can actually take online. So just to summarize, personal strategies, I would say try to accept the new normal, but don't have to give up. You can filter the information or the news you consume. Have a COVID-free day or weekend. Try to utilize a shift well-being plan where you have some important features of it that you can take into every shift. Normalize your conversation about well-being and shared vulnerability. Take advantage of your EAP, and also the college has a lot of well-being resources that are available freely, and extend your kindness to the other teams. Team strategies, that you can have huddles that can really galvanize your teams and plan the day. I think having some trust in your planning and leadership is important. Regular well-being updates, encourage and support staff leave. I think in most places these days have that concept. I think that's important to take that up and take everything online when possible. Social debriefs and mentoring is important. Mentoring is something that I think should be extended to all cohorts. And lastly, but not leastly, look, everybody knows what well-being is for them. For some people, it's just having some comfy things, having a nice drink, not being on their phone, and just watching some rubbish on the television. So thanks very much for listening to my presentation, and I hope you guys got some ideas and it's challenged you to think of certain things in a different way. And that was my aim today. Thanks.
Thanks very much, Abrar. Does anyone have any questions for Abrar? Okay. All right, if there isn't any questions, we'll have a break now. We'll reconvene at 1 p.m. Siba has got the next slot to give us a couple of presentations on some interesting toxicology cases. Thank you. We'll take a quick break and reconvene at 1 o'clock.